Alright, so we'll talk about another blood vessel. Okay, and this one is a blood vessel around the upper limb, and this is what is known as a costocervical trunk. Costocervical trunk. So looking at this image, this is what the costocervical trunk is. Let's look at the next image to see if we can be able to okay, this is the costocervical trunk. So the costocervical trunk, you should know that is what a branch of the subclavian artery, and it arises from the posterior aspect of the subclavian. It's usually just medial to the scalenus anterior muscle. So it supplies blood to the upper intercostal muscles and also the deep muscles of the neck. Okay. So origin is from the posterior aspect of subclavian artery. It typically arises medial to the scalenus anterior muscle near the vertebral artery origin. Okay. So it's actually more prominent on the left side than the right. So cause actually passes posteriorly and superiorly, coughing backward, okay, over the apex of the lungs. Okay, so the costocervical trunk gives rise to what? The deep cervical artery, and ascends in the neck, supplies the deep muscles of the posterior neck, and anastomoses with a descending branch of the occipital artery. Then also we have the highest intercostal artery, which is also a branch of it. So supplies regions around the neck, around the thorax, and also forms collateral circulation because of the various branches it has, forming all those alternative means. So it's very important. We study it because it's important in surgery, so as to understand the collateral supply and the variations it can have between one human being and the other.